He got his undergraduate medical degree from the Mumbai University in the year of 2004. He went and undergone his diploma in dermatology from St. John's University in Australia, following which in 2008 he did his PhD in ocular pathology and lasers. Besides having a successful practice in lasers and aesthetic medicine, Dr. Leroy Rebello lectured in reputed institutions such as AIIMS, JIPMER, and there are other medical colleges around the country. He has over 10 years of research papers published in the indexed journals. Dr. Rebello has participated in various clinical trials in the capacity of investigators, including stem cell therapy, PRP, etc. He also has 2 patents pending against his name. He is also on the board of a medical advisor for various aesthetic companies such as Paladin, Lysate, etc. He also is one of the founding director of a beautiful clinic called Eterness Clinic in India. Let's all welcome Dr. Leroy Rebello. I had the pleasure to meet Dr. Leroy yesterday, and I have to tell you that I was very impressed, and we should have him speak to us next year on laser advancement in the combination of radio frequency. I had a lecture on my own. I was very impressed.
Thank you so much. Thank you so much. I would like to thank the A4M for inviting me, the committee, and each and every one of you for being here today. We're going to talk a little bit about platelet-rich plasma, or PRP. We're going to take it to the next step, which is HPL, or human platelet lysate. When I first heard about HPL, it sounded to me like some Greek, Latin, some kind of medical jargon. But it's not that difficult. It is pretty simple. Tiger Woods. He is the person who first made PRP famous. When these words were published in the newspapers that everyone read, he said that he thinks that PRP injection that he received was an accident in his healing process, and he recommends it. Now let's take a look at the face. The aging face and a youthful face. The most simplest thing to do is to draw a line, and you see the curvatures of the line. If you cannot do this, you still have a simpler way. You also get nowadays a laser liner. You know the laser pointers, the one in a straight line. You see on the forehead, you see the line wrinkles up. You see the periorbital widening. You also see the malar widening, the jowls area, and you see the line is pretty distorted. Okay, so now what is PRP? PRP, or platelet-rich plasma, is an autologous product, means it comes from one's own body. It contains a lot of growth factors, fibrin matrix, high concentration of platelets, growth factors. Now, the difference between PRP and HPL. PRP is you inject the entire platelet. You inject the entire platelet with plasma. And HPL is you purify these platelets. After purification, the concentrations of VEGFs increase, the growth factors increase. These are some important growth factors present in the platelets, like platelet growth factor, insulin-like growth factor, vascular endothelial growth factor. All these growth factors are required for rejuvenation of cells, rejuvenation of cartilage, healing of wounds. In cosmetic medicine or in aesthetic medicine, in rejuvenating one's face, or even in orthopedic medicine, in rejuvenating cartilage, as to say in anti-aging medicine, all we play is with blood vessels. We want more blood vessels. We want the dermis to be healthy. Why does skin age? Because dermis is not healthy. Why does cartilage die? Because cartilage is not healthy. What we do, we want to improve the health of the cartilage. And how can we improve health? By increasing the nutrition. There is only one way to increase nutrition naturally in a body. That is to cause more blood supply over there. Cause more blood supply, add more growth factors, the cells start to proliferate. Now this is the healing cascade. You see first when there is injury or insult to a tissue, there is homeostasis, then inflammation, then regeneration and remodeling. You can see these are some of the growth factors that are present in each and every stage of inflammation. When I was asked to speak about PRP, I saw this photograph. It's a photograph of Elizabeth Taylor in her second marriage with Richard Burton. She was married to Richard Burton once, she divorced, went through 7 other marriages, and the 8th time married him again. On his marriage, on the 8th marriage, after the toast, the groom had to reply to the toast. So his reply was, I know what I have to do tonight, but my only problem is how to make it interesting. So when I was asked to speak about PRP, I knew everybody knows everything about PRP. But the only problem is how to make PRP a little bit interesting. So what is the benefit of PRP? PRP basically jumpstarts the healing process. It increases the growth factor level at the site of injury, because even while injection of a PRP, you have your needle entering the skin, and when the needle enters the skin, that causes little injury. Every kind of injury causes microscopic bleeding, and blood itself is a very good growth factor. Blood contains all growth factors, all the VEGFs come from the blood. Along with that, we purify the growth factors from the PRP and put it back inside. This is a conventional PRP where the blood is drawn, it is centrifuged at 8,000 RPM. It's a low RPM. And you re-inject it. You just re-inject it back into the face, or you can re-inject it back into the knee, or you can also use it for ulcers. This is a clinical process. It can be done in your clinic. You don't need any expensive equipment. This is a basic PRP setup. So some of the cosmetic indications: anti-aging, face wrinkles, neck wrinkles, hands, nasolabial, lip wrinkles, acne marks, foreheads, eye bags, hair, under eye, dark circles, loose and saggy skin. We have some orthopedic indications. PRP has been around for a long time in orthopedics. There have been more than 350 clinics in the US alone doing PRP for orthopedics. Platelet-rich plasma is safe and it is free from adverse reaction because it's your own blood. You cannot be allergic to your own blood. Platelet-rich plasma is also regularly used in India. It is legal because it is autologous. We have more than 30 peer-reviewed publications on PRP in international journals. Okay, now some of the clinical trials in PRP in orthopedics were on the shoulder, after shoulder arthroscopy, orthopedic sports injury. PRP works well in orthopedic sports injury. As an anti-aging physician, people come to you not only for cosmetic. While talking to you, they would tell you, sir, I have some injury in my back, or I have an injury on my ankle. You prepare the PRP for the face, and you can always give them another injection in the ankle, or you can give them an injection in the knee. These are some clinical trials on PRP. Now there is a new indication basically for PRP, which is they inject it on the glands so that the gland's penis gets thicker. And in women, it is also called the V-shot. They inject it in the vaginal area and along the clitoris so that the women experience more and more a better orgasm. So some advantage of PRP is that it's a non-surgical technique. It can be conducted in your clinic. You don't need any specialized equipment. You don't need any specialized training. Now coming back to the cosmetic way of injection, these points are very important, and this is the direction in which you need to inject PRP intradermally. Talking about lifting for PRP, you basically use it in different techniques. As in the cross-linking technique you can use the lining technique for lifting certain parts of the face. So depending upon what face, and I'm sure in the past 3 days we have all learned about how to analyze the face. After analyzing the face, we know where to put what and what indication. We use that kind of a PRP technique because we have learned a lot of techniques in the past 2 or 3 days for fillers. You can use the same techniques, they're absolutely the same. There is no special technique for injecting PRP. These are some results. You can see the texture has improved, some of the aging spots have gone, the dermis looks more healthy. Many women come to me with this complaint, like a turkey neck. PRP, we use it because it works very well. Because usually, apart from some cosmetic creams, some people use radio frequency. They don't get good result for turkey neck, but we've been getting quite good result for this turkey neck. Sometimes we may need to use PRP in conjunction with other therapies like lasers or the dissolvable threads. What we do is, as we said that yesterday, we learned how to create the scaffolding. We first create scaffolding with thread and then we inject PRP. That works as a very good lifting procedure. The next best thing to a surgical facelift. You can see periorbital rejuvenation over here. It works very well with PRP. In case the patient doesn't want to go for filler, or again you can see some other eyes with periorbital wrinkles. You can see it going away with PRP at HPL. Again, eye periorbital rejuvenation. Because eyes are very important. The most important feature of a person's face are the eyes, the nose. The first time you look at a person, you look straight. So what do you use? You use your eyes. Other indications of PRP are again wound healing, and as I said, fracture healing. We can use it in hair transplant, tissue rejuvenation, facial rejuvenation.